Welcome. Do you mind telling us who you are?
Sure. So I'm Parveen Parmar. I am faculty at the Keck School of Medicine. I run a division of global emergency medicine within the Department of Emergency Medicine at USC. In that role, I split my time between working clinically at LA County's emergency department at the General Hospital downtown, and I conduct research primarily supporting health programming for refugees and asylum seekers, both in the United States and abroad. I've got some active work with refugees and asylum seekers in the United States, particularly in ICE detention, and some work as well with Syrian refugees in Jordan.
Thank you. There's been a lot going on with COVID lately. And so I wondered if you could tell us a little bit in terms of what you're seeing in terms of your role in the emergency room and what you're seeing generally around COVID and basically how COVID is affecting you personally.
Where to start? Certainly with the global health work, it impacted our research pretty directly. So I've been working with a group of community health volunteers in Jordan with the International Rescue Committee to help strengthen health programming for Syrian refugees that have diabetes and high blood pressure. And the community health program had to be halted for a period of time because of safety concerns about people traveling from house to house. So the research went on hiatus for a while and now is returning, looking at a telehealth intervention. So we've had to modify our ongoing work pretty quickly. A lot of planned travel and collaborations, unfortunately, were halted. I think that's true for global health for everybody. In the emergency department, it was a really unique experience living kind of forward through an unfolding pandemic. I saw my first concerning case March 10th. So before it was really, before we had the kind of safer at home order spread across California. And at the time, we hadn't quite sorted out how to identify cases, isolate cases. Testing was still limited. And so just watching that unfold in the emergency department has been an experience. I will say, I think the emergency department at LA County has done an incredible job of figuring that out very quickly. And now we are operating with a dedicated COVID unit, and the leadership across the emergency department and the hospital have been really great. But we are still seeing cases, and some of this reflects the demographics at LA County Hospital, but we're seeing a lot of people that sort of don't have the privilege of staying home to avoid getting infected. People that work in delivery, that work in construction, coming in with cases of COVID, even today.
And I guess, one of the things we all are concerned about is, what do you think is that with the communities that you serve, and particularly meaning in LA, really thinking about your work in LA and your work with immigrant communities, your work in terms of ICE detention, but the communities with which you work in LA. What do you think about are some of the real issues we need to be thinking about in the immediate, but also kind of going forward in terms of kind of how COVID is impacting them?
I think it's pretty well known now that nationally, if you are a person of color, if you're Black, if you are poorer, you have worse health outcomes with COVID. And that is certainly something that we are seeing play out in Los Angeles County. As I said, I think the hospital and the county officials have really done their best to try to support all of LA citizens. But, the reality is that there are people that are still forced to work, and people that, don't have legal status in the United States remain more afraid to seek care. And we are seeing people, that don't have they don't have the ability not to work. They don't have the ability to sort of take a couple of months and not work, to self-isolate if they get sick, or to present for care if they get sick. So that's a real concern.
When you think about the US and when you think about LA specifically, but when you think about the US, are there policies specifically related to COVID that you think are really of concern that we all need to be paying attention to?
Unfortunately, the policies under the current administration have made a lot of people that don't have legal status in the United States, or people that have mixed legal status in their families, it's made those people afraid to seek care. And I think that in Los Angeles in particular, there's been a lot of efforts by the Department of Health Services in LA to do this, but continued efforts to ensure that people feel safe seeking care when they get sick and seeking testing when they get sick. Because obviously the stigma of being COVID positive is something we're really just starting to see and understand, and has real implications for people that are already, afraid just to be here in Los Angeles for various reasons.
It just gets me to think, are there some good examples of what government has done effectively in terms of California, in terms of LA, whether there's things that have been done to effectively address COVID and its consequences that are things that people should be paying attention to.
The Office of Immigrant Affairs here in Los Angeles County has done a great job of partnering with community-based organizations and having regular calls to make sure that people understand what services are available. LA County already has programs in place to make sure that people, regardless of documentation status, have ways of accessing healthcare. So I think that's a really great thing. Mm-hmm. I think one thing that has been done federally, done early on, was a decision that any COVID-related care would not be used against any ongoing applications for adjustments in legal status. So basically, the public charge rule would not apply for care sought for COVID-19. The translation of that message, ensuring that people really do understand that and really do feel safe, takes a lot of work after you've had, 3 years of a constant assault on your right to have access to healthcare.
The last big question for you then is, if you think about some of the most important things that we as a society can take out of this experience during the pandemic, what are some of the key lessons? What are some things you really want to make sure we're all thinking about?
So when the pandemic hit, a lot of people lost their jobs, as we all know, and we have employment-based health insurance in this country. That is a major problem. If we are going to think about responsible ways to take care of everybody in our community, in this county, in this city, in this state, and nationally, we need to move beyond employer-based healthcare. I think that's issue number one. Issue number two, it's really interesting and important that we now have a national conversation about anti-Black racism and structural racism in the middle of a pandemic. There are so many intersections between those conversations, and I really hope that this moment that we have now nationally to really think about the impact of structural racism on the health of all Americans. I really hope that this moment isn't lost in ensuring that we identify the way that structural racism exists in public health and medicine, and we really work to concretely change it.
I super hear you. Okay, thank you so much. Totally appreciate it.